Good afternoon. I'm Mark Roper with WMAR2 News, and June is Men's Health Month, and today we're talking about colonoscopies, and I'm joined with Dr. John Rabine. He's the Director of Gastroenterology at LifeBridge Health, and good afternoon, John. How are you today?
I'm terrific. Thank you for having me.
Great. This is a rite of passage that hardly anyone looks forward to, let alone likes to talk about. When is getting a colonoscopy the time that a man should start thinking about scheduling one?
Well, that's been a moving target in the last year and a half based on some new data. Historically, the average male would start getting colonoscopies at age 50. A few years back, we started at age 45 for African Americans, because they're at higher risk for colon cancer, but African Americans are often found to have more advanced colon cancer. So the thought was we should start looking earlier. Because colon cancer is becoming a bit more common in people under 50, the various groups are now proposing that we start at age 45 for everyone. So I would say that's the new standard of care as of today. If you have a family history of colon cancer, if you're seeing blood in the stool, these are things to talk to your doctor about, because there are circumstances we might even start earlier.
Is there any type of a school of thought on why this cancer is being seen in people younger and younger?
No, I don't think anyone knows that. Again, I still consider it quite rare. Colon cancer is a little tricky. There's always been some thought that diet may play a role. Ultimately, it just comes down to age and genetics as factors none of us can really control. But what's important to remember, and the reason we make a big fuss about colonoscopy, is that overwhelmingly colon cancers take years to develop. You start to develop precancerous polyps, and most of the time it takes 8 to 10 years for a polyp to turn into a cancer. And that's a large window of opportunity to remove the polyp and prevent a patient from getting cancer in the first place.
Are men more at risk for colon cancer than women?
No, men and women are about the same. And I always tell people, if you're waiting for symptoms, you're waiting too long. Waiting for blood in the stool or a blockage in your colon, for example, those things imply a very advanced cancer. When we talk about prostate exams, that's about finding a cancer very early on. A colonoscopy is not about finding cancer at all. The purpose of a colonoscopy is to prevent the cancer by, again, removing those polyps. So we want patients not to have symptoms. We just want them to show up because they're at that age where it's time to start looking. Any of us can grow polyps, and they don't cause any symptoms.
So not all polyps turn cancerous?
No, they do not. There are some polyps that will never progress. Even the precancerous polyps, not all of them are going to become a cancer. But as I always say, we shoot first, ask questions later. If I see a polyp, I'm going to remove it, and I'll let the pathologist tell me what type it was after the fact.
And when it comes time to make that appointment to get the colonoscopy done, I had one done last year. And when you tell people that you're going to have it done, the one thing that people kind of tell you about that almost scares you into having one done, everyone talks about the prep work into getting it done and that drink that you have to take.
Yeah, that's very true. The procedure itself is very easy. The procedure generally only lasts about 15 minutes, maybe 20 minutes, and patients are sedated. They're sleeping through that. They wake up not remembering anything at all. So the test itself is actually very easy. It's always the clean out or the purge the night before. But it's very important, even in patients who say they have regular bowel movements. People would be shocked to know how much stool is really in there. And it's like going to a car wash. You don't want to pay top dollar and have someone just kick mud off your car. You want it power washed. And that's what we need. I can only remove polyps I'm able to see. So that flushing is very important. But in the end, all it is diarrhea that will last 4 to 6 hours. Everyone's had food poisoning, but that will linger on for days. This is just a few hours, but it's critically important to get that colon cleaned out so that we get the best look possible.
That drink is something that you really only take when it's time to have a colonoscopy. But based on what you're saying, is that something that would be good for your body on a periodic basis anyway to clean out your colon?
There's really no data that you're purging toxins or that sort of thing. So we don't advise that. Now, if you have issues with constipation, certainly there are many of the over-the-counter agents that people take, like Miralax, for example, is essentially the same thing that we use in a bowel preparation, just lower doses. So certainly people can do those things to treat constipation, but we don't recommend it because it would lower your risk for polyps, for example.
And like I said, I had one done last year, and beforehand I was a little nervous and apprehensive about the whole experience, wondering what that was going to be like. But I must say, once it was all said and done, it was almost like I had nothing to be even worried about. I almost didn't even know that it happened.
Right. The next one will be very easy. The first one's always the worst. There's always anxiety. There's anxiety coming to the doctor and having to put on a patient gown, getting an IV put in, and that sort of thing. But that's a pretty universal sentiment. Once it's done, people feel a sense of relief. They don't have in the back of their mind any wonder about what's going on in their colon. They've been tuned up, if you will, and cleared for a few years. And definitely the second and third go around for patients, it goes much more easily. And if you're average risk, there's nothing about your medical history that increases your risk for colon cancer, and there are no polyps on that first exam, this is something that only comes up every 10 years. So it's not, you don't even have to endure it that many times during the course of your lifetime.
So if you have a successful one, you can wait another 10 years before you really need to schedule a second one?
As long as you're not having symptoms, if you were to start having bleeding, for example, at 5 years, well, okay, we will look earlier. But yeah, if you're having no symptoms, there's no high risk family history of colon cancer, then no, it's definitely a full 10 years.
And as I said, like when I had that experience, they wheel you into a room. I was lying there on a gurney or whatever you want to call it, and the doctor's talking to me, telling me what the procedure is going to be like, and then he gives me a general anesthesia, and then that's the last thing I remembered, and then I woke up into a room, and he was asking me how I was feeling. So is that general anesthesia, is that always the protocol? Is everyone always given a general anesthesia, or are some people given a local anesthesia?
Yeah, actually, it's not general anesthesia at all. Only the most high-risk patients would need general anesthesia, because general anesthesia is where they actually will have to put a breathing tube into your lungs, have you on a ventilator, and the sedation, even your brain shuts down and your brain's not controlling your breathing. This is actually what we call conscious sedation. And there's different medications that can be used. Nowadays, overwhelmingly, people are using propofol, which just goes through the IV. And although you're asleep and unaware of what's happening, your brain is still functioning. You're still able to breathe on your own without a ventilator. So that just makes it all the safer and easier. The beauty of propofol compared to some of the older drugs is that it wears off so quickly. People don't have some of the nausea and amnesia, grogginess that the other drugs might cause for a couple hours after the procedure was over.
And you just reminded me. See, I was so knocked out, I didn't even remember. I thought they gave me gas, but they did.
That would be just supplemental oxygen. You may not breathe as deeply when you're under sedation, so we supplement the oxygen levels to just make the procedure more safe.
I will say, when I was there, and I can't remember if it was my doctor first or when I was there at the clinic having it done, when they first told me that they were going to give me propofol. I mean, I did have a little bit of a hesitation where I was a little apprehensive. That gave me something new to be worried about. But
propofol is actually a very safe medication. Most states, including Maryland, that can only be administered by an anesthesia provider. Really, unfortunately, with what happened to Michael Jackson, that drug earned a bad name. But the circumstances with which he was given that drug and the manner in which he was monitored did not meet the standard of care. It would be nothing like a colonoscopy where, you have an anesthesia provider doing nothing but watching your blood pressure, your oxygen levels, your breathing. It allows, me, the gastroenterologist, just to purely focus on the procedure and what's going on in your colon. There's generally also a nurse or a technician in the room. So a lot of staffing, a lot of careful monitoring. And then even after the procedure's over, your vital signs and all are monitored for another 30 minutes afterwards to make sure that you're fully recovered before you're allowed to go home.
That should alleviate any fears or concerns that people should have. Like once they hear that word, it does set off some alarm bells in some people.
The complication rate for a colonoscopy is generally below 0.3%. So nothing in medicine is 100% risk-free, but all in all, the risk of a procedure like this is quite low.
And then afterwards, I remember, as you said, there's about a half an hour period where they just wait, check, and make sure that you're feeling fine and back to normal before they release you. And if I remember correctly, I think they said afterwards you're supposed to eat.
Well, this is where the nurses and I never completely see eye to eye. The nurses will often tell you to take it light that first meal. I tell patients, look, especially when they've gotten propofol, which again generally doesn't cause the nausea that some of the older medications would. I tell people, look, you've suffered enough. Go at it. Go to that buffet or whatever you want. So no, you really can return to a normal diet very, very quickly. What I tell patients is really the only thing you shouldn't do that day, or what you really can't do by law, is drive. You may feel awake and very alert, but again, Maryland law, you were sedated that day, and you should not operate a motor vehicle or any power machinery, that sort of thing, until the following morning.
Yeah, I think later that, like after it was done, I was awake, but later that afternoon, I think I might have felt a little more sleepy or tired than usual.
That may be. Some people respond to the sedation differently than others. Some people, depending on how late their diarrhea lasted the night before, perhaps didn't get their normal sleep in, and they're trying to catch up. Some people, I think, burn a lot of energy just being anxious. And then when it's all said and done and they calm down, there's no adrenaline rush. They're ready for a good nap later in the day.
And then it is almost a rite of passage where you hear people compare, like, oh yeah, I had mine done. It's almost like a badge. People wear it with a badge of honor. Like after you do get it done, people share that.
Colon cancer is the second leading cause of cancer death in both men and women. So behind breast cancer in women and prostate cancer in men. And what's so very sad about that statistic is that 90% of those cancers, up to 90% of them, would have been prevented had patients been getting their colonoscopy. So I think when patients have their colonoscopy, they should be proud. They took a step in taking care of themselves. They took a very effective step in guaranteeing or nearly, preventing their chance of getting a very, very common cancer. So there is something to be said for peace of mind and saying, look, I take my health seriously, and no one wants to have a colonoscopy, even performing them. I can't say that it's the bright spot of my day, but listen, this test is so effective, so important, and so effective that people should, I think, be proud that they've had it done.
And as you said, those polyps take so long to develop into cancer that it is a disease that you can essentially catch early before it even becomes a problem.
There are some variables that, there are people that genetically we think their polyps just grow unusually quickly. Patients who've had long-standing colitis, an inflammatory condition of the colon, sometimes don't have a polyp. A cancer just starts to grow. So there are always some cancers that don't follow the usual protocol, but yeah, definitely the overwhelming majority of patients, there's a big window of opportunity, and that's where that 10-year screening interval comes into play. Knowing that polyps don't grow very quickly, that's why we don't need to look every year or two the way we address other, screening for other cancers.
And when you talk about some of the genetics and whether it's hereditary or not, are certain diets more prone to cause people to develop colon cancer? Like, is red meat a factor? Eating a lot of red meat a factor?
Well, these are studies that are always open to perhaps some criticism or difficulty in interpreting. There is data that perhaps diets high in red meat, low fiber diets, diets high in nitrites, smoking, it's not dietary, but it should be discussed, can increase the risk. Obesity, there does seem to be a higher risk among men with obesity. So certainly these things come into play, but losing weight, changing your diet, how much impact that really has on lowering your risk is not clear. Ultimately what is clear is that nothing is as effective as just having a colonoscopy, because again, even if you were a perfect weight and you were running marathons and you had a perfect diet, that's not a guarantee that you aren't growing polyps. So I think it's important to be healthy and for multiple reasons, but in terms of colon cancer, again, I'm obviously emphasizing that the procedure itself is the best thing that you can do to prevent colon cancer.
And not to take business away from yourself, but I know for some people who might be either anxious, nervous, embarrassed, or whatever to actually have that colonoscopy, what do you think of those home tests that people can have done?
So there's actually a couple alternatives to colonoscopy. I mean, a lot of people over the last 10 years or so have heard of virtual colonoscopy, which is really a special type of CAT scan. But it's important to know that that is not equivalent to a colonoscopy. Most insurance plans, including Medicare, will not cover it unless you've had an attempted colonoscopy that couldn't be completed. And then if it's abnormal, guess what? You have to have a colonoscopy anyway. The test you're referring to, I think, is probably the Cologuard test, now that they're advertising on television. And Cologuard is great. So I think as a patient, if you're not willing to do the colonoscopy, doing the Cologuard is absolutely better than doing nothing at all. But I always caution my patients, they have to know the risks and benefits, the pros and cons. And those stool tests at home, the Cologuard in particular, does not pick up every cancer. It may miss actually up to 10% of patients who have a colon cancer. And roughly 30% of patients who have precancerous polyps, the test will not detect that. And then just like the virtual colonoscopy I mentioned, if the Cologuard is abnormal, we're right back to step one about discussing a colonoscopy anyway. So I think again, it's an option for people who are very nervous. It may be an option for patients who are extremely high risk for a procedure, and even the doctor is trying to avoid it. So there is definitely a role for that test, but people should not assume that it's equivalent to a full colonoscopy.
And those tests would only detect the chance or likelihood that you might have cancer. The test won't necessarily be able to detect whether you have a polyp because the polyp hasn't turned into cancer, correct?
No, the Cologuard test actually will detect genetic mutations associated with both cancer and precancerous polyps. So it actually can do both. It also is meant to detect blood in the stool. That does change the dynamic of the test a bit because it's not unusual for any of us to have microscopic blood in our stool at some point from hemorrhoids or something benign. And so if you were to have a Cologuard test and it was positive, I do tell patients, don't panic. That doesn't mean you definitely have cancer or polyps. It could be a false positive test result. You need the colonoscopy to sort it out and be sure. But there are some circumstances where the test is positive, but there's really nothing to worry about.
And so again, like if you get that positive test or positive test result, then they're going to have to call you anyway.
We're going to talk about the colonoscopy because now you don't know, I don't know, is there something going on or not?
And could there also be a concern of it missing things?
Well, exactly. As I said, even a colonoscopy is not 100% effective. It just happens to be the best option. But the stool test, again, you're probably looking at a 8 to 10% chance of not detecting a cancer that's actually there, and about a 30% chance of missing precancerous polyps that are there. And for those reasons, knowing that it's not as good as a colonoscopy, if you use a Cologuard for your colon cancer screening, that actually is supposed to be done every 3 years versus the 10-year interval for a colonoscopy.
And for someone who does go in and actually does have a colonoscopy procedure done and you do find something, what happens then?
Well, it depends what it is. Just like someone who comes in straight up for the colonoscopy, if we find polyps and they're not too large, we just remove them on the spot. The small ones, we literally just have little forceps and we just pluck them off. Larger polyps, we have different devices that will actually cauterize and shave the polyp out of there. If you have an extremely large polyp, those often can still be removed by colonoscopy, but it's a little more time consuming. Not all gastroenterologists are comfortable removing really large polyps. They may refer you to someone who specializes in that, or even if they're comfortable with it, they may say, look, I'm sorry, we're going to have to do a second colonoscopy because it's going to take me an hour just for that one polyp. Now, if they suspect it's a cancer, that generally we just do biopsies to have the pathologist confirm our fear that it is cancer, and then you would be referred to a surgeon.
And can you tell the difference just by looking at the polyp, whether it's turned cancerous or not?
Usually, I think any gastroenterologist who's been doing this for more than a couple of years, we're pretty good at looking at something and saying that does look like it's already a cancer. But some of the larger polyps will sometimes surprise us. We'll remove a polyp. The outside was indeed still precancerous, but the center that I couldn't see when I removed it was actually already a cancer. So there are times that I have to call up a patient and explain that I thought it was a polyp, but it turned out it was a cancer and that they should still have surgery or will need surgery for that. But that does not happen very often.
From us talking today, what do you hope that people take away from our conversation?
Well, I think two things. First off, colon cancer is common, and you don't want to wait for symptoms. This is just one of those things you need to do. It's really no different than flu shots and getting your blood pressure or cholesterol checked. And the test is so effective, you should do this. I think secondly, it's really not that big of a deal. It's normal to be anxious and a little nervous, but as you pointed out, once it's all said and done, people wonder why they were so scared of it. It really was not such a big deal. And again, a few hours of diarrhea, that's the worst part of it. So I think it's just important for people to realize it's really not such a big deal, and yet it's such a wise use of one day every 10 years.
Yeah, as you're saying, the day before is actually worse than the day of.
Absolutely, and I explain that to patients too. Sometimes patients are afraid they'll miss a lot of work, and I say, look, the bowel preparation is all the night before, so people can still work the day before, assuming they work a day shift. And really, they're just looking at the day of the procedure off work, because we understand that that's hard for some people to take time off work, but that's where it's important to understand it's worth it. If you don't have to do it very often, but it protects your health and in the longevity of your life, you and your family will appreciate that you prevented getting colon cancer.
Well, I hope in us talking today that some guys who are listening, and women, that they will be inspired to call their doctor if it's something that they've been putting off. I know I myself, I think I put it off for 3 years. I had it in the back of my mind until I figured, don't put it off any longer. Yeah,
that's important. And then, even for the women who may be listening and have had their colonoscopies, very often it's the partners who finally get that man to come in. So I often will joke with patients about that some guys will walk in my office and I can just tell their wife was nagging them long enough and they decided it was easier to have a colonoscopy than to listen to that anymore. So that's whatever it takes. If your husband's not doing it, ladies, find a way to get him in.
Yeah, I'm working on another story about the fact that men generally do not like to go to the doctor. And you may have heard of that Cleveland Clinic study that was done a couple of years ago, where they surveyed, I think, 500 men, and they took responses. And I think in the survey, it said it was around 72, 75%, maybe even higher, 77% of men would rather clean the bathroom or mow the lawn than go to the doctor.
I'm a doctor, and I would say I probably fall in line with that study. So unfortunately, that is true, and it's not just colon cancer screening, as you say. It's really across the board. Women, are definitely more proactive and better to listening to their bodies and following up on any symptoms they may be having. Men sometimes are a bit too stoic for their own good.
Right. We always hope that it'll go away. It'll get better. It's not that bad.
Right. But you don't know. And it's just not worth the risk or the chance.
Yeah. Especially with colon cancer. As you said, this is one of those diseases that in the early stages doesn't really present any symptoms. And you should be thankful that it doesn't present any symptoms, because by the time it does.
Actually, even more frightening is that many patients with stage 4 colon cancer still have absolutely no symptoms. They came in thinking it would just be a routine screening colonoscopy, and we do find a very advanced cancer, and they had no idea, no symptoms to correlate with that. So, as I say, symptoms unfortunately don't always help you.
And at that point, does that mean removing part of the colon?
Well, If you have an earlier stage of colon cancer, yes, the goal is to cut out the cancer. The surgeon will remove that portion of the colon, and depending on how advanced it is, you may need chemotherapy afterwards. If it's really advanced cancer, stage 4 metastatic cancer, generally surgery is not done because it will not cure the cancer. It's already unfortunately metastasized or spread. If you have a blockage from the cancer, just for quality of life, the surgeon may operate to fix a blockage. But again, the goal is to not ever let yourself get cancer in the first place.
Yes. Well, again, hopefully we can inspire some people to go ahead and call their doctor, make that appointment, have those conversations with their doctor, and to get it done. Well, thank you again, Dr. Rabine.
Rabine, you're correct.
Rabine, sorry about that. Dr. Rabine, thank you very much for joining us this afternoon and answering our questions. We will have this on our Facebook page as well as on our website. If you want to take another look, you can watch this also again on YouTube. You need to take some more notes about our conversation today on having a colonoscopy. So again, thank you, doctor, for joining us today, and have a great day. Thank you.